Do you think you have the right? Do you have the right to ask questions? Do you have the right to form an opinion and express it? Do you have the freedom to do so? Are you asking why the world's richest nation has meekly surrendered to COVID? Why the US has nearly 7 times the cases of the entire African continent and 5 times more deaths? Yes, Africa, 35,000 deaths in the entire continent, the same Africa with 1.2 billion people, 54 countries, and some of them don't even have a proper healthcare system. Somalia has 3,500 cases and 99 deaths. Really, what the hell? Ilan Omar, just fly to Somalia, it's safer there. What the hell, really? Even the red states, just the red states alone, have nearly 2 times the cases in 54 African countries. And the deaths? It's not even worth talking about. What the hell, really? 13 million people don't have a job now. We have no idea how many businesses have shut down and how many are going to close in the next few months because we are still infecting people in the tens of thousands, which means thousands will keep dying every week. Why did we surrender? And how did we surrender? Let's forget Africa for a moment. How did developed countries like Germany fight and win? How did Italy? Remember Italy, which experienced worst coronavirus cases in Europe? The hospitals got so overwhelmed at one point, they took help from the Germans and sent patients there for treatment. They have now completely reopened. How did they win? And why did we lose? And why do we continue to lose? Can we at least ask the question why we are losing? We can ask, right? I think we can. Germany had 11,500 cases in the last 7 days. Italy, 9,900 cases. The United States, 286,000. US has slightly more than twice the population of Germany and Italy, but we have 14 times more cases. So we are doing 7 times better than Germany and Italy in spreading the infection. Even if they double or even triple their speed, they will never catch up. Once again, what the hell? We lost it, period. And we are still not doing anything to change the way we fight it. Now, this is German Chancellor Angela Merkel on March 22, as the country had started to shut everything down. Take a listen.
We discussed today how our countermeasures are working. We have no vaccine and we have no medicine. All we have, firstly, are the efforts we are undertaking to prepare our healthcare system, especially hospitals, for the expected continued high rise in infections. And secondly, our own behaviour. This is currently the most effective means. That means reducing public life as far as is reasonable and cutting as far as possible our contact to those who could spread the virus.
So she comes in front of her people, tells them we have no vaccine, we have no medicine, all we have is our own efforts and we need to get our healthcare system ready. Nearly a month later, on April 20th, they started reopening. Now watch what they have done.
There are some regional differences. Each of the 16 German states gets to implement those measures in the best way they see fit. So, for example, here in Berlin, shops actually haven't opened today. That's due to happen later in the week. But I've just been watching some TV pictures of a school here, a headmistress wearing a face mask, opening the door to let one pupil in at a time into a hall where they're to sit their exams at a safe space from one another. So some schools opening to some pupils simply for exams here in Berlin. It is a cautious start, and I think it's important to say that in tandem with the relaxation of these measures, the authorities have said that they have beefed up their testing capacity. They can now run 730,000 tests a week. They're also strongly recommending that people wear face masks in shops and on public transport. In fact, some states are making that mandatory. And they're also continuing to aggressively contact trace to make sure that as soon as they know of a person who's infected, they make sure to find out who else that person has come into contact with so they can then be tested to avoid any outbreaks from spreading further. So it is a very cautious start. Not quite enough for Angela Merkel. Reportedly, she's said to have this morning told senior members of her CDU party that she's rather worried that the focus is all about the relaxation, when in her view, really the focus should be on the continuing risk and the necessity to really focus on making sure that the infection doesn't spread further.
As they were reopening, they had got the testing numbers so high, and they strongly recommended face masks, and some states even made it mandatory. And they aggressively contact traced. So they used the shutdown time, to prepare their healthcare system, got contact tracing in place, and used tools such as masks to reduce the rate of spread. People in Germany and Italy must wear masks when they are in public and in enclosed places like supermarkets, or else they pay a fine. It's 50 euros to 400 euros in Germany. In Italy, it can go as high as 1,000 euros. Now, this is what Mr. Donald Trump, the President of the United States, said on March 19, just one day before Angela Merkel telling her country that we have no medicine.
So chloroquine or hydroxychloroquine. Now, this is a common malaria drug. It's also a drug used for strong arthritis. Somebody has pretty serious arthritis. Also uses this in a somewhat different form. But it is known as a malaria drug, and it's been around for a long time, and it's very powerful. But the nice part is it's been around for a long time. So we know that if things don't go as planned, it's not going to kill anybody. When you go with a brand new drug, you don't know that that's going to happen. You have to see, and you have to go long test. But this has been used in different forms, very powerful drug in different forms. And it's shown very encouraging, very, very encouraging early results. And we're going to be able to make that drug available.
Hydroxychloroquine is showing very, very encouraging results. That's what he said. Just a day before Angela Merkel telling that there is no medicine. Where he got the data, no one really knows. Now we know that the drug he spoke about was just a fake drug. Germany, Italy, and other countries in Europe succeeded in containing the spread because their leaders did not talk about a fake drug and told people that the virus will disappear on its own and it virtually doesn't infect anyone. They did not tell journalists in a private call that it's lethal and go on live TV and told their citizens the exact opposite. They treated their people as adults. They understood that some won't like what they are doing, but they still went ahead and did it. They did what's best for the country and everyone who lives there. They did not treat people like idiots and kept lying to them. All these countries also have states, and regulations are not uniformly enforced just like we have in the United States. But the difference is they still act like a single country where a framework is given by the federal government and the states deploy them. They brought the cases down and figured out how to live with it. But we have 50 states, 50 rules, and 50,000 ways to implement, and hundreds of thousands of people encouraged to oppose anything and everything. There is no plan. The only plan is to do whatever you want, just don't ask me. Tired of the regulations that your local mayor and your governor is imposing? Ask the president why he is still refusing a national mandate. Trump was the one who said the cure is worse than the disease, right? Then business owners who are closing their businesses should ask him where the national plan is. Why are you still not establishing a national framework to stop this? Now the economy is tanking and he is on a non-stop state-by-state tour. People are losing jobs and he is hiring hundreds of legal experts to contest the election. The truth is, there is no plan to stop the coronavirus. There is a plan to win the election at any cost, and that's all there it is.
It goes through air, Bob. That's always tougher than the touch. You know, the touch, you don't have to touch things, right? But the air, you just breathe the air, and that's how it's passed. And so that's a very tricky one. That's a very delicate one. It's also more deadly than your strenuous flus. This is more deadly. This is 5 per, This is 5% versus 1% and less than 1%. So this is deadly stuff.
That goes away in April with the heat, as the heat comes in. Typically, that will go away in April.
So this is deadly stuff.
When you have 15 people, and the 15 within a couple of days is going to be down to close to zero.
So this is deadly stuff.
It's going to disappear. One day, it's like a miracle. It will disappear.
So this is deadly stuff. 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 So this is deadly stuff.